Hello, everyone. Welcome to today's episode of the Glow podcast. If you're new here, we are tailored marketing and we help dermatologists, skincare clinics, and aesthetic clinics grow their revenue. So if you want to learn more, just drop a comment below or shoot me a direct message. Today I have a very exciting guest here with me today from Charlotte, North Carolina, Ali from Meraki Aesthetics, and I'm super excited to have you. And I would love for you to just kind of go ahead and introduce yourself to my audience. Tell us a little bit more about who you are and what you do.
Absolutely. So my name is Ali Kitchens. I am a certified nurse practitioner. I started my practice 3.5 years ago, but I've been practicing aesthetic medicine for about 6 years now. I have a team of 8 incredible women. So we focus on skincare, we do lasers, we do functional medicine. We kind of do it all, which is really exciting. And I'm excited to get into talking about how we grew to that place because we weren't always starting there.
Yeah.
We started small 3 years ago, and it's just been beautiful to watch it grow.
Yeah, over 3 years growing to 8 people is a lot. So I can't wait to get into kind of more of that journey with you. And so what you mentioned kind of some of the offerings that you all have. You have, Botox lasers. So what inspired you to enter into the medical aesthetics industry in general? Because obviously you said you're a nurse practitioner. I'm sure you come from diverse background as most nurses do. So what inspired you to get into this industry specifically?
Yeah, that's a great question. I honestly feel like this industry found me. I was in the hospital. I worked in a med-surg unit as a nurse. I also worked at a plastic surgery office, and I saw the nurse injector there, and I was like, I was super interested in what she did from her day to day. And so I started to research, and I started to research so much that it was just taking up all my time because it was so intriguing to me. And so I just kept learning more about the aesthetic industry and reading papers and reading research. And I was like, this is where I feel like my passion is lying, because it didn't feel like work. I mean, I'd be at work looking things up. I'd be stopping at her desk. I probably annoyed her because I was like, what is the platysmal band? Like, I needed everything. So I was working in the OR at that time, and I worked in the OR for a good amount of years. But there was one point where I just kind of sat down at a coffee shop. I'm really strong in my faith, and I was just praying over where I needed to be. And I had a mutual friend. She actually was my babysitter. She walked in and was like, "What are you doing?" And I told her that I was just praying about where I needed to go in my career, and she kind of set me up with this whole cascade of opportunity to be able to open my own practice. I actually started working at a plastic surgeon's office that didn't have injectables, and I told him that's what I was passionate about, and he allowed me to grow that for him, which was really incredible. And he just supported me along the way. He's actually still my medical director.
That's awesome.
And he doesn't care about lasers, Botox. He does breast augmentations, a lot of body work. He's really passionate about that. He's incredible. He actually was just ranked number 8 in North Carolina for plastic surgeons.
Wow.
So that's really awesome to be associated with him. And then I opened my location in his building. So he's just really supported me along the way. So I just feel like the path was kind of laid out before me, and it was something that you can either choose to follow it or choose to do your own thing. And I just felt the further I got into it, the more I realized like this is actually where I'm meant to be, and I'm meant to be a leader, and I'm meant to help people grow and become the best versions of themselves in this aesthetic field.
I feel like that's such a cool story too, that like you were practicing in a plastic surgeon's office who didn't offer, what you wanted, what you were really passionate about, and they allowed you to really show your passions, and then that led into you starting your own business. So I feel like that's a very unique and like inspiring story too,
Thank you.
So that's awesome. And so I guess getting into a little bit more about your business, obviously, what kind of sets your medical spa apart from other medical spas in Charlotte? Like what are you like, this is our bread and butter here.
Yeah. Yeah, I'd say it always starts with the experience. Me and my office manager, Shannon, we work really, really hard to create a really positive culture filled with team members that want to be there, that are excited to be there, that are passionate about what they do. You know, that doesn't mean there hasn't been hills and valleys of trying to, we've had to let go of some team members that we've really loved, but we really, really make sure that you're passionate, because that's really where the patient experience will change. I think one of the beautiful things yesterday, Emily got a compliment. She's our front desk executive, and she says it's beautiful to see patients walk in one way, kind of shy and scared and timid, and then when they leave, they're completely different people. They're so happy, they're laughing, they seem like they're your best friends, and I just think that's a huge testimony to how the experience makes patients feel from start to finish. So I do feel like that's not something that you can get everywhere. We are guiding the treatment plans. We're not allowing our patients to guide them. We obviously work together for a mutual agreement on what we think that treatment plan is going to be. But I think that sometimes in medical spas, you can get into this place where, a patient sits down and says, I want cheek filler, and then the provider just does it, whether that person needs it or not. So we practice with very strong ethics and morals of always offering first and foremost what's safe for the patient and what's best for the patient. We're never going to offer something just because it's financially beneficial to the provider. It's always going to be based on what they need. And I think that's where that passion kind of comes back in. Of course, it's amazing how when you are a nurse injector, you can be very financially successful, but I think that doesn't necessarily mean you need to compromise on your ethics and just offering, treatments because you want to make money. So we've been really strategic about who we've brought into the team, and so I think that really changes the experience, and that's something that really allows people to see that difference when they come into our practice. We also very much prioritize education. Every year, I typically will take my team with me to 1 or 2 conferences, which a lot of practices don't do, but I'm proud of that. I'm proud to invest in them financially because they come back more motivated, they have more education, more knowledge, they know better treatment techniques, they're safer, and they're really excited about it. So I don't think everybody's always investing in their educations or in themselves, and that really definitely gives us a advantage in the Charlotte area.
Yeah, no, I feel like that's super important too, because if you're not constantly educating yourself, then you're just kind of staying in the same place. And so educating yourself kind of allows for that growth mindset and like a little bit more too of like that creativity and like spark kind of. So no, I think that's super, super cool. And so going back to kind of something that you said a little bit earlier, you were like, if like a patient comes to us and they want cheek filler or, whatever it is, and we are like, that's probably not what's best for the patient right now. How do you as a provider kind of decide those things? Like, okay, you know what, this is maybe not the right path for them. Let's kind of steer them down another path.
Right. I think there's so many different factors that kind of go into it. It really comes down to your knowledge and understanding and experience. I think that you need to understand if someone's had a lot of bony loss, you should be able to detect that. If someone's had a lot of fat loss and fat pad changes, you need to be able to understand that. Or is it laxity from the SMAS? Is it the tissue, the epidermis and the dermis that's lost a lot of collagen and elastin? Like, you really have to know what's going on. We have a few different technologies that we can use to gather, almost like, sometimes I feel like a detective, to gather all of the information, what's going on in their personal life, what kind of stressors have they had from the environment, have they been on medications? We have had some patients that have been through breast cancer and they're in really low places after that. They want to feel confident again. They've lost a lot. They've been focusing so much on their health. And so to be able to take that patient and say, okay, they've been on chemotherapy medications, they've whether they've had their uterus removed, they don't have any kind of estrogen replacement anymore. I need to know those things from a lifestyle and kind of health side. And then I move into, well, what's happened to the face? What have they noticed? Have they seen that their eyes look more tired? Is it from bone loss or is it from fat? I think that there's just a myriad of things that can be occurring, and it's looking at all of those factors and then developing the treatment plan that way. But really, that often does come with experience and just over time kind of getting to that place. I didn't start there, 6 years ago. Yeah. I just was like, I think cheek filler would look nice on this person. So I guess there's a bit of artistry to it. I think that you have, as an injector, when you are a great injector, you have an eye, and it's something that sometimes can't be taught. It has to be, a creative piece of your brain that you are able to see what that person needs from an aesthetic plane, whether it's shadows and light reflection, and there's so many things that kind of go into it. But I do have a funny story. I have something in my room, it's framed in my room, and it was what do I want to be when I grow up? And I think I wrote this when I was maybe 8, but I wrote, I want to be an Olympic swimmer and swimsuit model. And then I said, and if that fails, I want to be a plastic surgeon. So it is really, really interesting just to see that. We found that when my parents moved out of their house 3 years ago. So I was already deep into this industry.
Yeah.
So it was just so solidifying and understanding that I have followed that path that was laid before me and that I should be following. And it was just very validating to know, wow, this is something that was already written before I even thought about it, right? So yeah. That is funny to think about. I love that little piece of my room. My patients will read it and they're like, that's hilarious. I'm like, I was not a swimsuit model, nor was I an Olympic swimmer. But
you're like, but here I am, and this is the closest thing else to what I wanted.
I think if I would have known what an aesthetic nurse practitioner was, I think I would have written that out. But really, the way this field has evolved hasn't always been a job that or a description that most people are, look or interested in, right?
Yeah.
Or have seen. It's kind of evolved into that. Because plastic surgeons do surgery, and then most of the time there's some really great injectors that are plastic surgeons, but most of the time nurse practitioners, PAs, RNs, they kind of handle that injectable side.
Yeah, no, for sure. Well, and then also I feel like too, some of the stuff now that we have that aesthetic nurse practitioners and PAs and things like that are doing, we didn't have those things a long time ago. It was almost the only option for a lot of stuff was invasive plastic surgery. And now we have
fillers that wouldn't even necessarily touch myself. There has been so much advancement in technology. It is amazing.
Yeah, no, for sure. And that kind of brings me a little bit to my next question too. Obviously, you all have kind of a lot of treatments, obviously, at the practice. What are you kind of most excited that's up and coming with innovations in the aesthetic industry right now?
Yeah, I think AI is a really big buzzword right now. It's pretty incredible to see some of the AI technology that's coming out. And I'm curious how that's going to affect some of the devices that are on the market and how that will change things. We do carry the Cyton BBL, broadband light IPL device, and there's different technology platforms on that device that you can choose from. Their most advanced form is quite literally the device kind of treating the patient more than the actual provider. So it's hard to describe, but essentially it's sending that pulse light with the movement of the provider. So if the provider stops, the light stops. Yeah. Whereas right now what we're doing is, we're delivering that energy with a foot pedal at the same time that we're treating the patient. So they've developed this technology that is, I honestly can't remember what it's using to guide it, but it's like a device that sits over the patient's body. And so it's tracking with the handpiece, and it's delivering that energy as you move. So you can go as fast or as slow as you want to, which is really, really cool. So when we demoed it and we trialed that technology, I was like, this is amazing. And I just can't wait to see what's coming out in the future, because I know that Cyton's not the only medical device company that's looking at advancing their technology. So there's going to be a lot changing, but I still think that a provider is still going to be needed. You obviously I don't think that people will be removed. It will just make it safer. It will just be a little bit less controlled by a person. There's going to be a combination. It's going to be like a partnership between technology and people.
Yeah, no, for sure. Well, and I also feel like too, for something like as personal as, your aesthetic health and really health in general, you want a person there too. At least like me personally, I know that like I want a person there who's going to be able to reassure me, because even if the technology advances, like you can have trust in technology, but it's nothing like trust with a person.
Right, exactly. And there's still so much with that capability. Like you still have to pick the energy and the patient skin type. And so it is a partnership, but it is cool to see that it is going to be a better safety kind of parameter to help patients provide safer treatments.
And so, kind of going off of that too, with the technology, how do you see kind of the industry evolving over the next 5 years? Obviously, AI and technology is going to have a significant impact, but is there anything else that you're like, yeah, this is something that's on the horizon for us?
I think there's a lot of things. It kind of just depends we're specifically talking about. I think overall, like an overarching theme is going to be kind of utilizing our body's ability to regenerate, repopulate, and create new things. So when you think about like biostimulation or bioregeneration, those are really big buzzwords in the aesthetic industry right now. Biostim is essentially stimulating something that's in your body, and then bioregen is actually regenerating new things. So I think that's an important difference to understand as providers. Biostim is going to be your PLLA, your Kaha, Sculptra, Radiesse, and then bioregen is going to be more of that exosome therapy type, building from your own cells, your own body, or from someone else's, depending. But I do think that we are going to lean more into what is inside of our bodies that is repairing our cells, and how can we replicate that or increase that or upregulate that. And that kind of leads into a little bit of like functional medicine in a way. I think that they go hand in hand. We have to make sure that we are addressing our overall health in conjunction with these aesthetic treatments, because you can give someone Sculptra all day long, but if their hormones are imbalanced, you're not going to see that great of an outcome. So I think that's where it comes to that like holistic approach for a patient again. People aren't going to see those great outcomes unless they're really being treated with an in-depth consultation and understanding of their bodies, and having a practice that is going to be able to address those hormones, as well as being able to treat with the products that will stimulate their body after the body has been kind of corrected.
Yeah, no, I mean, that makes sense for sure. I feel like a holistic approach is going to be so important, because it's like you can look good all day, from whatever procedures, but it's also like about feeling good, and especially as we get older, like things you tend to not feel as good. So it's like that's a super important component to it as well. And so kind of going off of that too, when you are talking to patients, and you're like, okay, we can fix all these things aesthetically, how do you make sure that you're giving kind of a personalized approach? Because obviously it's very individualized,
Right.
One patient is not going to need the same thing as another, and then also kind of going into that holistic approach with it too.
I think it really comes from a really great consultation. I think that consultations really will make or break your ability to give a great outcome or not. We spend an hour to an hour and 20 minutes with each patient when we're doing a consultation, because we've got a full intake. I get into everything with my patients. I want to know about their lives outside of work or outside of seeing me in the practice. I want to know what their day-to-day lifestyle looks like. And oftentimes there's just things that, again, with experience, you hear someone say, and it's like a buzzword for me. I'm like, they need to get their hormones checked, like,
Yeah.
I haven't been sleeping really good in the past few years. I have a lot of brain fog. I'm so tired. Things have changed. I'm like, okay, these are all little buzzwords that I'm in my head creating this entire plan for them. And I think that faces are so different. And I love that there is a personalized approach, especially at Meraki, because we're able to really target what that patient needs specifically. There isn't a a standardized is what we can do. I don't believe in that. I think some providers in the aesthetic industry think that you can place this here, that there, here, all these different injection points, and then you're going to create a beautiful result. And I don't necessarily agree with that. I think that it's completely unique to the person. It's what they're experiencing, what their lifestyle is like, because of course we're going to have a great outcome that day, but like, how can we keep that outcome long term, right? How can we hang on to that collagen that we stimulate? How can we hang on to the HA filler? What's going to break it down quicker? What's going to cause more sun damage? Like, how can we prevent things from continuing to escalate, and how can we be more approaching it more preventatively?
Yeah, no, I think that that's a great perspective, and it's so individualized for each person, because obviously each person looks completely different, they're gonna need completely different things. And then I love too that like you are spending time with them. It's not like, okay, you come in and I do your Botox and then like, bye, see you next time.
Right.
It's like you really are figuring out about their lives because you care about their long-term results. It's not just about getting a good result that day, but it's like, okay, how can we make sure that you're looking and feeling good long term?
Yeah, and I think that's what makes the difference between successful practices and not successful practices in the aesthetic industry. It's where your heart is, where does your passion lie? If it's financially, you're never going to succeed in this industry because you won't be doing the right thing for patients. You have to really care about people and really be invested in their life. I think that some people also believe that there is this client-patient relationship, that you need to keep your boxes, but I don't think that's how we're meant to care for people and connect with people in the world. I think that there doesn't have to be a box that you're my client and I can't get into a friendship level with you. I love my patients. I love learning about their lives and seeing them outside of work too. I'm happy to go, have a coffee with them or meet up with them at a workout class. I think that it's like we're meant to touch people and to care for them and to affect their lives in a positive way. And how can we do that? Only by really investing in them and being okay with having that deeper relationship.
And I think that is so important as well, like really connecting with people, not just focused on, okay, how do we treat this patient even? Like, of course that's important, but it's like, okay, how can I like connect with them and really form a relationship with them? So I feel like you all probably do a really, really good job of building kind of that trust and credibility aspect. And so what treatments right now are you seeing? I mean, especially with us being in summer and everything like that, the weather's warming up. What are you seeing right now, treatments that are the most popular right now at Meraki?
I mean, obviously bread and butter is Botox and filler all day. There's not much time associated. Sometimes people get a bruise or two. So that's pretty much year round. We are always slammed with Botox and filler patients. I'd say for the skincare side, microneedling is a pretty low downtime treatment. I mean, most of the time, 24, 48 hours, our patients look back to normal. We package some of our treatments with pre and post care. So it just helps to speed up the process a little bit more and have as much downtime, them a little bit quicker. Obviously they want to be out of the sun after they've had a microneedling treatment, but most of our patients, they are fully prepared. They get pre and post treatments. They are able, pre and post treatment instructions. So they're able to know what to expect and also how to care for themselves afterwards. So wearing a hat, staying out of the sun, don't go to the beach right after you have microneedling. But I do feel like microneedling is something that you can do year round. Topical peels are a little bit more challenging. Laser is definitely going to be laser season. So that's going to be during the fall and the spring, right before it starts to get really warm and you're outside a lot. Facials, we always love a good diamond glow and always just a regular relaxing facial with a dermaplane. There's not much downtime associated with those. So I feel like the summer can sometimes get hard in that skincare department, but we can make exceptions for certain patients that, may not go out in the sun at all or really have much sun exposure and are really going to follow their treatment plans and their pre and post care treatment instructions. But other than that, I think that skincare, usually microneedling is pretty big, and then Botox and filler all year round. We also do Ultherapy, which is my favorite device and my favorite treatment to date. This is the only FDA approved non-surgical tightening and lifting device.
Okay.
I love bowl therapy. It sends micro-focused heat energy down to different layers of the tissue, but it bypasses the superficial portion of the skin. So you're not having any downtime on that outside visually, but you do have some swelling internally, but that can be done year round as well for some tightening and lifting in the jawline. So love bowl therapy. That's year round as well.
Awesome. Yeah, no, I love that. Yeah, Botox and filler I feel like are, always the big ones for sure
Yeah.
because that's just what people tend to need the most. And so what's your vision for kind of the next 3 to 5 years for the med spa? Like where do you see you all going? We kind of talked about where you see the industry going, but where do you see Meraki as a practice going?
Yeah, that's a really exciting question and something that as a visionary, whenever you own a practice, you are the visionary for the team. You get out of that injector role and you move into that kind of admin business person. Like it's kind of crazy. We didn't go to school for this. We went to school to care for people and we understand medicine. But it is really interesting as that changes, as the team grows. And I've kind of learned to step back and allow my team to flourish, which has been weird. I think that sometimes some practitioners, their whole business is around them, right? But I think I've found what's really the most rewarding for me is to see my team get better and grow and become more passionate and support them where I can. Each individual person, like that's been the most rewarding for me. So I've kind of stepped back into that visionary role. So looking at the next 3 to 5 years is something that I think about often, but most definitely within the next maybe 1 or 2, we're going to need to expand into a new space. We have a 2,000 square foot space right now, but we need double, if not triple of that.
Wow.
Which is crazy. And we're still going to continue to grow at this rate. So definitely expanding into a larger space. I've considered a second location as well, but we have patients that drive from all over or fly even. We have patients from Miami, West Virginia, Atlanta. I mean, they're all over the place. So for me, I feel like when someone sees your value, they will travel to you because they're going to get an experience at Meraki that they can't get anywhere near them.
Yeah.
So I've considered a second location potentially outside of North Carolina. So that could be on the radar. We're still going to continue to grow our functional medicine side. So I expect our team to get bigger there just to help more people from a health perspective in the community. And as technology advances, there's more and more things to offer, which is beautiful. We might get into a little IV therapy. I haven't fully decided there. We just don't have the space for a few things right now. And so I'm really building out that next location is where I'm getting into the nitty-gritty of what we'll need for expansion.
Yeah, no, that's amazing. Super, super cool. It sounds like, and that's awesome that you all have patients traveling to you from like other locations because obviously, I mean, as I'm sure you are well aware, there are a ton of med spas out there, like they're everywhere. So they are specifically choosing you. They're like you said, I can't get this experience anywhere else.
Right. So it's amazing.
And so this is the last question kind of before we hop off. What's the most rewarding part of your job? I know you've mentioned you love your team. Obviously, you're very passionate too about helping your patients. And so I'm sure that there's many things that have been rewarding. But what is kind of your favorite part and most rewarding?
Gosh, that is such a tough question because I do think that it is amazing to see. It's super rewarding to see my team kind of like just grow in their roles and become leaders themselves. And see them learn new techniques and finally master it. And it just watching them light up lights me up inside. I'm just so excited to see that. But I do think that it comes back down to patient care at the end of the day. I had one patient recently that she actually had a crazy like COVID viral response where it inflamed her temporal artery, and it actually she lost tissue in between her brows and her hairline because of a virus, because of COVID. So she has a ton of scarring in between her eyes. It's always flaking and bleeding. And I actually collaborate with a local dermatologist, and she, was saying this is the rarest case that I've ever seen of this happening to someone. So she actually referred her to me and said, is there anything you can do Botox wise or even filler wise for this patient?
Yeah.
And so I ended up treating her scarring area with a little Botox to relax some of the muscles so that it can release some of that tension on the scarring. And that was a super rewarding experience because she had never done anything aesthetic. She never focused really on she focused on her appearance after a rare viral situation where she lost tissue. And then finally to see her kind of see some of that restored and to get relief on the area. She wasn't flaking as much. There wasn't as much tension in the area. There's not as much bleeding. So it's just cases like that. Even my breast cancer patients, my patients that are going through divorce or who have lost a child, it's just in those moments I am treating with them and talking with them, and I just I hug my patients. I love them. I am so grateful that they've brought me into that piece of their life that's really, really hard and tough to go through. And I just think that seeing how they feel when they leave, I hope impacts them in their day-to-day life. So I think that's always gonna forever be the most rewarding thing.
Yeah, no, that's amazing. I think you said it so well too. Like it's just impacting them. Obviously, everybody has things going on in their lives, but if you can just make kind of like one small impact on them, then obviously it's always like a ripple effect kind of with that.
Mm-hmm.
Awesome. So I would love for you to tell my audience kind of where is the best place to find you on social, your website, where to find Meraki, all of those fun things. And then I will also link it in the show notes as well so that it's easy access. But if you want to go ahead and tell everybody, that would be amazing.
Awesome. Yeah. So you can follow me on Instagram at injectoralley_Meraki. And then we have Meraki Aesthetics & Co., our regular Instagram account. And then you can go to our website, MerakiAestheticsandCo.com. And those are really the best places that you can connect with us on socials. We have a lot of other providers in the practice. So we have Injector Jenna _Meraki, Injector Lowe _Meraki. Rada is our functional medicine nurse practitioner. And then we have Liz and Haley, esthetician Liz, and In With the Skin. So they are all great providers to follow. They always have tips and tricks and educational things, and we have a lot of fun and entertainment on there too. So you can find all of those accounts from our main account in Meraki.
Awesome. Cool. Yeah, I'll link everything below, and I really, really appreciate you coming on, and it was so fun to talk, and like it's so amazing too because you can tell that you are very, very passionate about what you do and helping other people too. And so thank you so much.
Thank you for having me, Taylor. I appreciate it.
Yeah, of course. Thanks.
Thanks.